If somebody has just a little bit of love, dignity, respect in their life, it can brighten their day. And so no matter what is going on in one of our patients, or, when we talk about any person who interacts with our practice, we want their day to be better because they stopped by.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. Welcome to a special episode of Growth in Dentistry for our Practice Growth series. I am Katie Polson and I have Steve Jensen with me. Say hi so they can hear you. And we're just excited to continue this series on and having a great practice, Thrive Dental. We've got Dr. Benjamin Friberg and Jennifer, his office manager, with us today. We'll get into that in just a second. But before we do, for those of you that are Facebook nerds, I guess, I don't know if you'd like to be on Facebook, join us there. We've got a dental intelligence community that's awesome, and you can get more information about our products or how to use automation and things like that. So if you are hanging around Facebook, join us there. For those of you that are new to our podcast, this is your first time listening, welcome. And this is our Practice Growth series. This is kind of an hour-long episode where we get into really the nitty-gritty of practices that are in our top 10% that have done some excellent stuff. And on the back end, how did they get that data? What makes them excel in those things? So these are actually my favorite episodes to record. And then we also have a shorter kind of 30-minute episodes with some of our key opinion leaders where we tackle problems. So I'd encourage you to go check out all the content there. We have over 120 episodes now. You can just dive right in. And then also for those of you that are not a returning listeners, thank you so much. Thank you to those that have rated and reviewed this podcast. It helps a lot to push us to the top of the 160 plus dental podcasts that are out there. I can't even believe that there's that many anymore. And then this podcast is brought to you by Dental Intelligence. So if you wanted to see how it can work in your practice, we have a great giveaway to those listeners of our show. You can go to get.dentalintel.com/podcast. And get $50 when you complete a demo. And I'll make sure that link is also in our show notes. So without further ado, let's get into it. Welcome, both of you. Thank you so much for joining. If you are watching on YouTube, you can see this cute little dog bum. That's so cute. Look at that cute little dog. And what's her name? Meadow. She's the office dog.
That's right.
Awesome.
We'll get into. She's a little bit more than the office dog. She is actually a team member with us. So she is quite a special dog. Actually, she's been went through over 2.5 years of training to work in the dental environment.
Oh yeah, we're gonna get into that.
Awesome. Yeah.
Okay. All right. Well, we'll have you tell us a little bit about that because that's pretty stellar. Okay, so tell us first of all. Let's start with you, Dr. Friberg. Do you want me to call you Dr. Friberg, Benjamin? I don't know. As a hygienist, everyone's always doctor. So you tell me what you want me. Ben, okay.
It's gonna because it's either Friberg or Friberg, and it'll be easier for you to say Ben.
I'm gonna mess it up eventually. Yeah. Okay. Well, tell us a little bit about yourself, how you landed in dentistry, and go from, and then we'll have Jennifer kind of do the same.
Yeah, I have a little bit of a kind of different path to dentistry. My original degree was in business management with a minor in construction engineering from Oregon State University. And when I graduated, I was asked to be a vice president of a construction company in the Northwest. I started both of their kind of seasonal Pacific Northwest businesses, had crews of about 150 in the peak seasons, and they hated every minute of it. You know, that line from Office Space is like, today is worse than yesterday. So every day to me is the worst day of my life. Like that was kind of resonating with me a little too strong. So I pivoted careers, went to dental school in 2011 and graduated in 2015, and then practiced for about 4 years as an associate in 3 different jobs, and learned a lot of things to do the right way, learned a lot of things to do the wrong way, and kind of honed in what I wanted my practice to be. And in 2019, I opened the doors of my scratch startup practice, Thrive Family Dental, in Wilmington, North Carolina. So we've been, this May will be 4 years.
Awesome. I love that you actually, not only did you graduate in it, but you like worked in it. Like,
yeah.
And business management, I mean, my goodness, you have a leg up. Yeah, that's awesome. Jennifer, tell us a little about how you landed into Thrive Dental.
I actually started as a dental assistant in a part-time job in high school, and decided to go into hotel and restaurant management when I went into college, and decided that was quickly not going to be the career for me, and went to school for dental assisting, graduated, and worked for a periodontist full-time as an assistant with him for 5 or 6 years. Then had a family, moved, came back into a pediatric practice when I started back on the administrative side, and needed a change from that. And friends of mine kept saying, there's this new dental practice opening. It's called Thrive Family Dental. You really should check it out. And I put them off one time, and then she called me again and said, you really need to check this out. And so came in, had an interview with Dr. Friberg, and basically said, when's my start date? Because I wanted to be a part of the practice. And I think you were only open for about 4 months at that point.
Oh my goodness.
So yeah.
Can I ask you, because I know, and this is not on our list, but I know you can answer it. There are a lot of practices I know that are struggling to hire. What about the office or your interview, or 4 months in to a brand scratch practice, what made it feel like I have to have this job?
It was all Dr. Friberg. It was all Ben. It was his philosophy and how he wanted to run the practice, and how he was adamant about how he was going to treat people. And he said, I'm the only one that has to stay here. Everybody else can quit. So I may as well run a practice where I want to be. And these are the reasons why, and this is how I'm going to treat people, and this is how we're going to treat people, and this is my vision. And I was like, give me the Kool-Aid, I'm ready. Like, let's go.
Awesome.
Yeah.
So I just felt like it would be a good fit. And thankfully, 4 years later,
you're still here.
It's been a great fit.
Yeah.
That's awesome.
Yeah, I'm very happy to be here.
That's so cool. And then I also, before we move on, I wanted to ask, Ben, do you have advice for associates that are currently associating? They're in their associate currently. What's the verb for that? I'm like, because you obviously learned a lot in your 3 positions, right?
Yeah.
To a point where you've figured out what kind of practice you wanted to do.
Yeah, I would say being focused on the great things that allows that practice to be busy enough to have an associate. Like, what are the key elements that are allowing this practice to be big enough that the owner needed associates, right? And if it's in corporate dentistry, what are the great systems that corporate dentistry offers that you can incorporate into a private practice, right? Use the genius of those around you. Take notes, study and focus, not just on doing your dentistry, because if you aspire to be a practice owner, there's so much more that goes into dentistry when you own the practice compared to as an associate. So use that time when you're in between patients and waiting for things to happen, to learn and focus, and also look at things and identify the things that that you don't want to do, so that when it's time to sit down and create your vision and your business plan and start seeking out that process, whether it's an acquisition or a startup, you have a mental framework of how you're going to do things. And that kind of gives you some kind of internal confidence, self-confidence that you can achieve the practice that you want.
That's great advice. Do you did you know you wanted a scratch practice right out of dental school? Is that something that you knew, or is something that you developed?
I knew that I wanted a scratch practice before I got into dental school.
Really?
Like, having the business background, having done startups in construction before, I knew that I wanted my DNA to be the only DNA in my practice. What I mean by that is, when you buy a practice, you inherit the DNA, you inherit the culture, you inherit the practices, habits and systems. And that is a lot of kind of tide to swim against to convert it to the practice that you want.
Mm,
So I knew that for me that the scratch practice was the only way that I wanted to approach
awesome.
going into it.
So tell us a little bit about Thrive Family Dental. What makes you guys different in that North Carolina? Well, different probably in the nation, but that dog is going to set you apart already. But different in your area, and tell us about the values and the practice.
Did you actually have the vision?
Sure. So the vision of the practice, definitely what drew me in for sure is that we treat every person, whether they're a patient or a vendor or the FedEx guy or the water delivery guy, with love, dignity, and respect. So we kind of treat this as a place, a safe place. So, well, it is a safe place. It's not, we all come here and we don't know where they are coming from. And when they get here, they are anxious, they are having a bad day, somebody's cut them off on the road. And basically our job is to listen and love and meet them where they are. And it has made Ben's practice very successful.
Our practice, I like that. That's the point.
I love that. Yeah, that is the point, is to have your employees take ownership and say it's our practice.
Mhm.
Yeah.
And that's something we definitely do. That is, we've had employees in the past that had lost sight of that vision, even though in Morning Huddle, we pretty much kind of review that every day and make sure we're all in that kind of giving, grateful mindset. Not to say that we don't acknowledge when one of us is having a bad day, because we do, but we're here as a team to support that person. And I mean, just yesterday, I was like, so I'm at about a 75 today, like not feeling 100%. And he's like, okay, it's like, I got you. And it was, I think I just needed to say that for somebody to hear me say that. And I think that's what everybody wants, is they just want to be heard, whether you're the male guy or one of our patients.
Or staff member.
Or a staff member,
Yeah.
or a team member. Yeah.
That's awesome.
Yeah, I mean, the guiding principle of love, dignity, and respect, that's based on my faith. That's how I felt when you read about Jesus, that's how he treated everybody around him. And so I want that same experience. If somebody has just a little bit of love, dignity, and respect in their life, it can brighten their day. And so no matter what is going on in one of our patients, or when we talk about any person who interacts with our practice, we want their day to be better because they stopped by. Mm-hmm. It goes that deep into the way that we treat people, and to how we curate the experience that they have here, all the way down to the materials that we use and the procedures that we perform, and how we perform them is filtered through that vision of love, dignity, and respect. And so that is been the drive from day one of day zero of this practice, is that is the overarching theme of way that we interact just as humans to each other. And so that's I would say that level of commitment to that vision is something that separates us.
It seems like you've created just an extension of yourself. That's awesome.
With a lot of help from my team.
Yeah.
Each person who interviews here, and they resonate right with that vision. They want to be a part of that. And so when they come on board, expressing that vision to our community is part of them too, right? Because there's people who haven't fit here. Yeah. And it's not their practice, right? It's not an extension of who they are. So the team that we have really, really understands that and embodies that, and it's why they're here.
That's so cool. Well, it sounds like you set yourself up for some serious success, and that shows in the data behind, I mean, what you guys are able to accomplish in the short amount of time that your practice has been open. Talk to me a little bit about just the size of the practice, so people can kind of get a framework from where they are in their practice to comparing to yours. Sure. So when they hear these numbers, how many ops and
we're on the second floor of a medical complex building with terrible signage. We have
Very true.
2,200 square feet, 6 operatories, and we have 6 team members plus me. We have Jennifer and another front desk. We have 2 dental assistants, both DA2s, and then we have 2 dental hygienists.
Okay, awesome. That's a very busy practice in a small, you guys are running around on each other.
We call them roller skate days.
It's a good visual.
I saw this on the
So
show before.
thankfully, our office is like a circle. So they come in one door, they loop around all the operatories and
Oh,
kind of
good.
come back. So
Oh.
we were constantly
Oh, that's
like
nice. Yeah,
running
that
around the track.
that's a good idea. That was good layout on your part if you did
It
that.
worked out very well, for sure.
That's good.
It's
Where
nice.
my
We have a square footprint, and I know a lot of the newer offices that are being built now are rectangles. They're long and straight, and so you have a
Yes.
hallway, and then you have everything on one side, and
Mhm.
it's a lot of football pads and drop the
Yeah.
shoulders to get through in the busy times.
Yeah, I mean, we don't need another reason to go to the ER because you got poked by something on someone's tray. I'm not speaking from any personal experience here. Okay, well, let's get into it. So I
Can
want
I call out one thing?
Oh,
before we
yes,
move
yeah,
on
go
to?
for it.
So, Dr. Friberg, something that you said that I really liked, I'm going to call back to the beginning and what you just mentioned. So a mentor of mine, his name's Alex Dunn. He's one of the, a leader here in Utah that helped build a company called Vivint. I had the chance to sit down with him. And one of the questions that one of my peers asked was, Alex, how do you establish a good culture within a company? And he gave advice that I really appreciated. And I think that you're showing this well in the way even that you just communicated. He said, a lot of people will try to manufacture culture. And he said, it's just not realistic. You can't create something that doesn't really exist. And he said, and so you'll find through your career, and as you look and observe people, that culture just becomes a reflection of the leaders that are in place, right? And I think hearing you speak and then hearing Jennifer speak, it's clear that this culture of love, dignity, and respect is clearly a message throughout your office. I mean, you can feel that as you guys communicate. So that's really cool. So kudos to you for that. And then also something that you mentioned at the very beginning as well that I want to call out. Either it was you or Jennifer that said that you're the only one that has to stay here. Everyone else can leave, right? And I think recognizing that as a person, right? I'm the one that's going to lead this business. If you're a practice owner and you're listening, what is this culture that you can't manufacture, but how are you treating those around you, and what's the experience you're trying to create? And is it a place where people are going to want to stay there with you? And so just kudos, Ben, for the culture that you've created through this belief system that you have and that you share in your
there's a
business.
lot of
Very
people
impressed.
a lot of people in the industry that look, they wake up one day and they realize how did my practice end up this way?
Yeah.
And if that rings true to you,
Mhm.
reach out. I mean, reach out to Ben, reach out to someone who can help you kind of focus that. And what kind of practice do you want to have? And then move forward in that direction. Because you give a great example of you don't have to own a practice that you're not happy to go to anymore.
That's right. And the responsibility of that is solely on the owner.
Yeah.
Right. It's theirs to create. In the interview process, I have a very specific line in my interview that says, I will rabidly defend my company culture because I'm the only one who has to work here.
Cool.
So I want them to know that is how, I am incredibly intentional about the way that this practice feels. And when we come in, how it should be run. And what's been interesting is I track my 5-star reviews daily. That is my number one metric that I use. Did my patient have a 5-star experience here? And there have been 2 occasions where our culture was suffering, where things weren't good. I mean, our culture just wasn't flowing. There was friction, right? There was just friction in the office and between team members. And through some mediations and some meetings and things like that, we realized that we had someone who was not a cultural fit for our practice. The day after she was let go, we hadn't had a 5-star review in 2 weeks. We had 3 the next day.
Wow.
Right. So it's a continual reminder that you have to be proactive in your culture and with the way that the team is operating to continue to kind of level up our practice.
That's awesome. That's great. Great. I mean, we're big fans of data proof, and that is definitely one of them. Okay. So let's talk a little bit about maybe some of the challenges that you're like currently trying to overcome. What's bothering you guys?
We are currently changing some of our insurance participations. So going out of network with some of them has been a challenge for some of the demographic where we have gone out of network with their insurances. Some of them have said, well, I will stay with you. I don't care whether you accept my insurance or not, whether you're in or out of network. And some of them have said, well, that's a shame. I'm going to have to find somebody that's in my in-network now.
Yeah.
So I think what we're doing about that is trying to, one, educate patients on what it means to be an out-of-network provider and what it means for their benefits. And two, in doing so, in educating them, helping them see the value in what we do, the value in the services that we provide. Caroline is my assistant in the front, and she and I work tirelessly to provide education for our patients on insurance. That seems to be the biggest question that most of our patients have when they're coming in the door to us. So I really think seeing the value in educating and just our overall coming to us.
Yeah.
Right for
Yeah.
them.
And there's a lot of consultants that would say, and I've heard them say, it's not your responsibility. It's not your insurance. They should know their insurance, right? Like it's not your responsibility to educate your patients on their insurance. But
That does not
without,
align with our vision.
yes,
Yeah.
exactly,
Does
right?
not align with our vision at all.
And so I love that you're willing to take, because it takes a lot of time to help someone understand that dental insurance does not like their medical insurance, and they don't, they don't understand it. So what are you, we might jump ahead a little bit here, because I know you guys are doing, offering payments and using payments in Wisetack to collect. So is your goal to be fee for service at one point, or what, or are you planning on accepting insurances? I guess, what's your exit? Like, what's the exit strategy, I guess, if you do have one?
Strategy.
Do you have one?
As far as our insurance participation goes. So we will most likely always take assignment of benefits even if we're out of network participating. We are methodically going through we have for the last 2 years, basically, we've been going through contract optimization and renegotiations. And then we've kind of settled with those negotiations. And now we're looking at systematically going through and looking at the lowest paying ones that actually are reimbursing below overhead. They're immediately, without question, I'm sorry, we literally cannot financially participate with this. It is being subsidized by my fee-for-service patients, and that's not fair to them.
Yeah.
Right. And so with our vision, that does not fall under the vision. And so we've ended all of those contracts. And now we're just kind of working our way slowly through the remainder of the lower reimbursing contracts and kindly leaving with them. We are going slow. We did consider ripping the Band-Aid off and just going out of network with all of them, but that would have been overwhelming for our patients and for our team.
Yeah.
So we're just going slowly and methodically, chunks at a time. It also allows us to have better communication about why and what we're doing for our patients. Trying not to just have them show up, and be like, oh, by the way, we're out of network. Good luck. So
it also helps you measure it better too. You measure like the impact of each one that you let go. Yeah.
Right. And so every month when we do our P&Ls and when we do our production to collection ratios, we want to see that percentage difference between gross production, write-offs, and collections shrink. And so the goal is that our write-offs are no more than 20% on average.
Yeah. And you can see that in the data. I mean, it goes down, right? It's pretty incredible. Unfortunately, I mean, and people probably think that I hate insurance companies with the amount of times I dog on them because I mean, I don't, and it definitely has its place, but the healthiest practices that we have in our data sets is they're completely fee for service. So it's just a tricky balance to make. So what do you, tell us a little bit about your experience with offering like external financing and, or getting patients to pay their portion when they are fee for service. What's your process with that?
I guess that falls to me. So with any of our patients, when we're presenting a treatment plan, we do everything. We are considered a paperless practice. We have iPads for all of our forms, consents, treatment plans, everything gets popped up on the iPad through Modento. So we've attached Wisetack financing. We've attached all the different payment options for the patients. It pops up, it populates with their insurance portion. So they're very, very well aware of what their fee is going to be. Then we talk about, they have a 50% deposit at time of scheduling for their portion, whether it's in or out of network. If they can always pay in full if they want to. They can use Wisetack. We talk about that. We do also have an in-house payment option, but we consider it a prepayment option. So it's not put your deposit down, we do treatment, and then you have a 3-month payment plan. It's put your deposit down, you have a 3-month payment plan, and then we do treatment.
Gotcha.
So then they are already paid by the time they come back to see us.
Smart.
Yeah.
So that way we're not the bank anymore. And that way it's easier for me doing the collections. If they miss a payment, we just don't schedule it until they've paid. If they choose that option, it's very well laid out. They've signed the agreement, they put a card on file, and it's all automated, which makes my life a lot easier. We just look at the report once a month and say, okay, well, this person missed a payment or this person didn't miss a payment. We can go ahead and move forward with treatment. As far as Wisetack goes, we have had patients sit right in our checkout area and they're like, yeah, go ahead and send me the link now. Do it all on the phone. They're like, okay, I was approved. I'm ready to go. Like, I can do all of it right now. So that aspect has been fantastic with getting some of those larger cases scheduled kind of for very close in the future.
Yeah.
I'm interested to know, of those different payment options, do you have a general idea of which what percentage of patients fall into each bucket? Like, is 80% they're just paying cash for it, and then the other ones fall into that 20?
Yeah, that's interesting.
What
it's gonna obviously be based off your demographic and the patients you serve, but yeah.
I don't actually.
Okay.
I think in the time that we've been doing Wisetack, we've probably had 4 or 5 patients sit right here and do it and get approved for it. I send out a lot of the pre-qualification links and I say there's no hit on your credit to just kind of play around with the numbers and see. And if that's something you decide you want to move forward with, send me a message. I check all of our messages through Modento, which is a great way to communicate with our patients about it. And I'll just send you the loan offer. And so I've done that a couple of times. I would say most of our patients are probably paying their 50% deposit and then they're paying their balance at time of service.
Yeah.
That's generally
which I think
which is
resonates.
perfect.
Yeah,
and what you would like them to do.
Yeah.
Wisetack tends to come into play more with larger cases.
Yeah.
If an appointment's going to be 5, 7, 8 grand, that's when we start to see that people start looking for third-party financing for stuff like that.
And then I would assume your internal payment plans is probably like a similar volume to what you're doing with Wisetack. Like, it's less common than your traditional 50% down and then at time of service.
Yeah.
Cool.
There was a point where our in-house payment plans were
Post-treatment,
right. And they were a lot.
Yeah.
And we've finally kind of whittled it down to where we're letting somebody else be the bank instead of us.
Yeah.
Yeah, that's great.
It frees you up a lot.
Yeah, as a startup, I had a lot of kind of more lenient financial policies in my practice, had our own payment plan, things like that, and was in network with, you know, every insurance, because empty chairs are very expensive, even compared to write-offs. So now that the practice is established, that's where we've been able to really tighten up our financial policy over the last about 18 months, to get control of, because our, you know, just being honest, our accounts receivable was over 1 month's production.
Yeah.
We were getting into that danger zone where we really didn't want to be. And so we've been, as a high producing practice, there's always more and more and more accounts receivable showing up every, you know, in 0 to 30. So keep making sure that we're actually picking it up on the other end was really important.
Yeah. And it's a big lift. I mean, you've got 2 front office and a really high 2 front office team members. I don't know why I always do that. It's not, you don't have 2 front offices, they're team members. But that's a lot in a high producing office to do that, insurance verification and answering the phone and making sure everyone feels loved and felt like they had the best day ever. Right. So it's really important for you, Jennifer, I would imagine, to have those automated systems in place, so that you feel like you have an extra team member that you don't have to pay for. I mean, I'm speaking for you, but I would imagine that's.
Yeah, it definitely helps. And even on the collections side, when I'm looking at accounts receivable and saying, or if I'm even just putting in an EOB and I see somebody, you know, they downgraded a filling and they owe an additional $75, I can easily just print a statement so it's in their ledger, pull up Modento, send a payment request, type in a note, attach the statement. And I would say 9 times out of 10, a patient will message back and say, oh my gosh, I'm so sorry, and pay it immediately. And it took me all of 2 minutes to do, where I got them directly. I didn't have to leave a message. I didn't have to print a statement. I didn't have to use a stamp. I didn't have to go to the post box. And now we've got our money back. So it's that, I think, for me, has been a huge help.
Yeah, that's awesome. I'm grateful. I mean, on this end of it, you know, that's our end goal is to make the lives of practices like yours a lot easier. Maybe think of anything else with automation or payments? I'm going to move on to treatment acceptance.
Yeah, I want to go there too. I keep
I would say
staring at
the one
case
last
acceptance
thing,
number.
the one last thing as far as payment is that all of our clinical team members take payment.
Oh my gosh, that's
Cool.
awesome.
Yeah, so that's one reason why we don't have a third person up front as an insurance coordinator, is because the checkout has been dispersed amongst 4 team members.
Great.
Which frees up Jennifer and Caroline to do those other 2 tasks.
Yeah.
The patients love it because they don't have to stand in the front with gauze in their mouth, or they just they pay, they go from that room to their car, rather than one more stop on the way out of what's never a fun experience, right? It's dentistry, right?
Yeah.
So we try to limit as many areas of discomfort for our patients, and standing in line, especially when you have 2 hygienists and then 2 to 3 patients sometimes from the doctor side, sometimes about 4 people that need to be checked out within 10 minutes.
Right. Yeah.
So if we have 4 team members doing it all simultaneously, rather than bottlenecking in a line at the front of the practice, it's just a much more seamless transition for our patients, and it frees up the front.
Yeah, absolutely. And I think a lot of practices are trying to move that way, where they're trying to cross train their back office and their front office to kind of do some of the same things, because we are in a staffing shortage, right? And so for 2 reasons, it's better patient flow, but also you've got all of these little cross-trained employees that can all kind of help with those tasks. So when you need help with them, they can actually do them. That's awesome.
If I can just add something to that, that's part of what we've been doing from day one, is that we call it, it's one of our core values. It's all hands on deck. So if you are legally allowed to do a service, you will be expected at some point to do that service. So I can't clean teeth and I can't take x-rays, but I can see the patient, I can chart, I can take notes, I can assist. I can do,
if you're wearing closed-toed shoes.
If I'm wearing closed-toed shoes.
You are my man.
But similarly, so one of our hygienists assisted, one assisted earlier this week and the other assisted today. So
sat chairside with me because that was the
Yeah.
most efficient, effective way
For her
us
to spend her
move forward
time.
through the practice.
yeah,
Oh my gosh, it makes everyone feel like this ownership, like they are a part of this, they take ownership of everything. And as a hygienist, my value doesn't end when I'm done cleaning teeth, right? And I hope that is filled with, I love that you're establishing that in each of your team members, that see a need, fill it, right? And you can learn a lot by assisting, right? In your treatment
Correct.
presentation as well. You know, you can see, he normally does this. And when he comes in, he's probably going to suggest a crown here because you've seen it in real life. Yeah.
Yeah,
That's
so
awesome.
the hygienist sat down with me this week and we did selective caries removal technique with an indirect pulp cap.
Oh, uh-huh.
She knew that if there was deep cavity, that's what we would prescribe. But now she actually saw me selectively removing caries to preserve the pulp health. And I showed her the stain in the tooth. And that was a learning opportunity for her. And so now she can speak more confidently.
Yeah.
When I diagnose an indirect pulp cap and I leave the room and the patient does this.
What? Yeah.
Do I need that?
Yeah.
Right? Like they look immediately to the hygienist or the assistant. As soon as I leave the room, I go, right?
Mhm.
And the hygienist now can say, yeah, that's exactly what you need. I've seen them do it.
Yeah.
So that cross training really helps with that confidence.
I would imagine, and we can get into it, but I would imagine that is one of the main reasons why your guys' treatment acceptance is at 80%.
So high.
Yeah, it's
really
very, very
exceptional.
high. Above 10% of all of our practices in that we have access to, which is over 9,000. So that,
Fist pump.
yeah, fist bump is for sure because of that, because of the cross training and that's exactly what the patient does. As soon as you leave, they look to the person that they've spent the most time with that day, which is the assistant or the hygienist. And if they're not educated or if they don't believe in the treatment, because I've been there, I've been a hygienist where the associate and I did not see eye to eye. And our treatment acceptance between the two of us was in the low 50s.
Right.
And you could see it.
Yeah.
And so it makes a big difference. Yeah. So tell us a little bit about that. What do you think are the number one reasons that would make your case acceptance that high?
The vision, right? So from the time they interact with us on the internet, right? Because that's where everybody starts, they see our Google reviews, which is the social proof of the experience that people have had here of the vision that we have created, right? Comfortable, caring, compassionate, calm, listened, right? So these are some of the key words that flow through all of our 5-star reviews. And that is the first place that they interact with us. That's where the first layer of trust, right? A lot of times in case presentations or in sales, we talk about the football field, right? You've got to move the ball down the field to get to the final case acceptance, right? So that's the first level. And that's a big, big push.
Yeah.
Then they call and they get Jennifer or Caroline, who are on the phone the nicest, most fun people you'd ever want to talk to. Like they get it. Like it is their best friend that they haven't talked to in 5 years. Every time the phone rings, oh my gosh, how are you? Thank you so much for calling. I'm so excited for you to call Tribe. Tell me what brought you to call us. And they're just brought in, right? That more trust, more care, right? They feel cared for and listened to in that phone call. They come in, everything's been automated, like we've talked about before. All of our, as soon as they're scheduled, they receive an email, right? They get all of their online forms. So it's seamless. They walk in, there's 2 forms they have to fill out. One is we want a verbal description of Meadow so they understand that we have a working animal in the office. And then they're seated in an operatory within 10 to 15 minutes. We have a specific overflow chair so that if 10 minutes goes by and they're not seated, Jennifer or Caroline, hey, we got a room ready for you, let's bring you back. And they get put in the overflow. So it's just every little bit is a sequential addition to that trust factor. And then we believe really strongly in the co-educational treatment model. Or the co-diagnostic treatment model. So we take our films, we take our photos, we take an intraoral scan, collect all of our data, full mouth probing on every new patient, and then the hygienist will walk the patient through, take them on a tour of their mouth, through their films, through their photos, through their 3D scan, and talk to them about their goals. Why did you come to the dentist? Why are you here today? What are ways that we can help you reach those goals, right? And so we get this information of why and what they want, right? That information is conveyed to me. We have, I don't have any cards here, but we have a laminated card system for all of our patients where all the pertinent information that I need for that patient is written, either circled in pre-filled forms, and then notes of things that I should know beforehand.
Yeah.
And then I walk in the room and I spend at least 3 to 5 minutes building rapport, talk about where they're from, how they found practice, if they've been a referral, we chat about their friend and how awesome they are. After that, we talk about their goals, what brought them to the practice, why they're here, how I can help them. I asked about their dental history, any dental trauma. One of our focus is treating the dentally anxious and fearful without medication. So when somebody walks in my office and they go, no offense, I hate the dentist, I'm like, I'm your guy. Yep, you're at the right place. And that's where Meadow comes in. I mean, she's specifically trained for that purpose, to help bridge that gap of fear. She had a long day.
Nothing to be afraid of on that couch, that's for sure.
And then I will then lean the patient back, do a full oral cancer screening, and then exam. And I will then again walk them through x-rays, photos, diagnosis, any issues that might come with those diagnoses. And then we treatment plan in phase based on the conversation we've had about patients' goals and need, right? So we have to balance those. It's like, oh, I want whitening. Well, the house is on fire. We need to worry about some other things first. So let's meet somewhere in the middle. And then my final question after we kind of walked through all that and phased everything, I try to make it very clear. Okay, so on your first appointment, we are going to work on the 3 teeth on the lower left and the 2 teeth on the upper right. After that appointment, you'll come back and we'll be, so they understand the phase, so they can get the picture, kind of break it down into small pieces they can understand. And then my final question is, before I go, what questions do you have? Open-ended. It's a question of expectation of questions, because do you have any questions? A patient is uncomfortable. They don't have necessarily the knowledge base or the time to even know what their questions are yet. So I ask an expectant question that they do have questions, to let them feel free to ask.
That's great.
So going through all this, what questions do you have about what we've talked about today? Is there anything that you feel was unclear you'd like more clarity on? Things like that, so that we start a conversation back and forth. Does this feel like what we talked about at the beginning? Does this treatment plan meet those needs?
Yeah.
Right. So those review questions bookends that appointment between goal setting at the beginning with the hygienist and then reestablishing those goals with myself. And then at the very end saying, did we meet your needs? Right. And then I pass it off. I say, so now that we've got that phased out, I'm going to return you back over to your hygienist. She's going to walk you through the rest of the process, take you up front where Jennifer or Caroline will talk to you about time and money, how long each appointment will take, when we can do this appointment, and how much each of those appointments is going to cost. And then that's, et cetera, et cetera. I have to drag Meadow out of the room because she wants more pets. So that's how we treatment plan. That's the whole process. And then kind of turn over to Jennifer to wrap it up.
I think that because we all do speak the same language and because our team is cross-trained, it just makes my job that much easier. I mean, Dr. Friberg already kind of sets up the expectation for what the patient will encounter when they see Caroline and I at checkout. So they're already expecting to go over their treatment plan. They're expecting to look at financing. They're expecting to schedule an appointment. So if we tick all those boxes, then they're like, okay, my expectations have been met. So, and I ask them to, I go over their treatment plan with them, again, presented on the iPad, and I go through each appointment, that's subtotaled and phased out. And I said, this will be your portion at this visit. This will be your portion at the next visit. This is what we estimate from your insurance company, so on and so forth. And at the end, like Dr. Friberg asks them if they have any questions or concerns, I do the same thing. So I'm mirroring that language
Yeah.
and saying, you know, I know this is a lot. What questions do you have for me? 9 times out of 10, it's about phasing the appointments, because we'll do quad on the upper right and a quad on the lower left at the same appointment, and they'll say, oh, is it okay if I break it up? And you know, usually it's fine. And I make it known to them that the reason we do that is to decrease the amount of appointments they have, to make it more beneficial for them, so they don't have to come see us so many times.
Yeah.
Because most of our patients don't like coming to see us. So
Yeah.
I mean, not that they don't like coming to see us.
They don't-
they're-
nobody
They
wants
don't
to
like
sign
us-
up.
They don't have to go through the work when they.
Yes. Yeah.
Yeah,
I mean,
they are already fearful and anxious when they get here. So to limit the number of exposures to our practice
mhm.
for that helps them.
So both of you, I love that question that you both say. I mean, after the finance part and like the question part of what questions do you have? How many, I mean, give me a percentage of the time that a patient doesn't ask a question.
In my, I would say 50-50 for me. I feel like having the hygienist walk through everything, kind of preparing the patient for me.
Yeah.
Then I feel like I offer very good clarity to our
Right.
patients.
Uh-huh.
And I will actually, the more complicated a treatment plan is, the more appointments or the more procedures that are necessary, I will review a treatment plan 2 to 3 times with that patient in different language
Wow.
until they're like, okay, I got
get
it.
it. Yeah.
Like,
Uh-huh.
so I don't want, because the biggest barrier in most cases, other than financial,
hmm
is lack of understanding of what is going to happen or the need behind it.
Yeah, for sure.
So that I try to just continually beat that
Mhm.
into them for
Yeah.
understanding.
Yeah.
Right. So
I guess the reason why I asked that is I think that if you're listening and if you had to take that percentage and address it to you, like how many times does someone, when you say, do you have any questions, how many times do they say that? I think that if it's not very often, then they're leaving with unanswered questions. You're just not
Correct.
framing it
Yeah.
right.
that's right.
Yeah.
Yeah.
That's awesome. Well, kudos to you guys. Can I ask you, this is kind of a selfish thing for me because every one of these that we've done, they all have a common thread. So how long are your new patient appointments? How long do you block off?
We block off 90 minutes.
That's awesome.
Yeah.
Every single one. Yeah.
Every new patient appointment, one thing to mention is a practice tour that's been specifically curated and scripted to address specific pain points that patients have coming to the dentist.
Mm.
So we talk about our giving wall. So Pause for People is the organization that raised Meadow. That so we're a partner with them. So 10% of every new patient exam is donated to Pause for People, and so we want their first experience to in our practice to understand that we are a community partner. We're not just another dentist on the corner. Next is on the tour is my office. My door is always open, and so it's Dr. Friberg has an open door policy. If there's any other questions or issues that you have, feel free to give him a call or stop by. He returns any phone call, even on weekends, within 24 hours if he's available. Next is sterilization. We have an open-based sterilization with tilt-out bins. So we say we have open-based sterilization because we want every one of our patients to know the process and procedure that we keep them safe by sterilizing their instruments. And then the tilt-out bin is very organized for all of our OCD patients. They see that like, ooh, I want that in my kitchen.
I know, right?
Introduce the treatment rooms, introduce the hygiene rooms, the imaging, and then patient bathroom, right? And so once they get that tour, they're now familiar with their landscape. They know where the restroom is. They've been exposed to the environment, and now they can take a little bit of concern and anxiety out of that appointment because they've been oriented to where they're at to help calm them down.
So cool. Well, I think if you need a hygienist and I move to your area. I'm kidding. I'm sure you've got 2 that you really love. But oh man, your patients are so lucky to have you. Is there anything else that you want to ask before I ask kind of my final question?
No, this has been an absolute treat. So thank you guys for sharing. I've been enlightened in a big way. I think the culture you're setting is amazing. I think it was very interesting for me to listen to you talk through the way that you treatment plan. There's so many of those things that's fascinating to me. A lot of what you share, I think, are consistent behaviors among practices. And so a lot of people are always like, well, how can Dr. Friberg do what I'm doing, but we're getting a different result? And I think a lot of that comes down to what you said, doctor. Like your very first response to our question on why is your treatment acceptance so high, you said it comes down to your values, right? Like you're thinking through that whole experience from the time they engage with you on your website all the way through, and making sure that your values are experienced from the beginning to the end. And I think that's shining through in the way that you measure your success. So really exceptional job. It's been fun to listen to you guys talk through that.
Yeah, I love that. And so good. Well, so I ask the same question to everybody that comes on the show, because growth means a lot to us here at Dental Intelligence, and it means something different to everyone. And what does growth in dentistry mean to you? And you can both answer it, or one of you.
I'll go first.
Oh,
Because I want to be long-winded, if I talk about it. Keep going.
I think growth in dentistry for me is, for right now, it's a personal growth. I'd like to continue on the path of, we talked about this before the end of the year. My goals for this year would be growing as a leader and really taking this practice to the next level, and making sure that I'm doing everything I can to support my team and lead them to their own greatness.
That's great. How great. What about you?
So I think having come from the startup realm, growth for me was all about survival.
Yeah.
Right. The practice had to get to a critical mass to survive. We had to have enough production, enough collections, so we had profit, so I could pay the bills, so that I could, continue to own a practice. So for the last, for the first 2 solid years, we were shut down for a 1-year anniversary because of COVID and just that scramble of survival. Growth was all about just more patients. Bodies, we need more patients. And now we're fully booked. Right now, when can we get a new patient in?
Don't ask me. May.
In May. So right now, for a 90-minute new patient exam, we're booking into May. And treatment is over 4 weeks out for a major appointment. And so now it's not about growth. It's not about new patients. It's not about more patients. It's about refinement. I guess it would be more, instead of bigger, it's deeper. Right. So we want to be better at what we do at every level, so that we're more efficient, we're more optimized. Our goal this year is actually to produce less dentistry than we produced last year.
Great. That's a great goal.
That's awesome.
Yeah. And collect more.
Yep.
So that's the true goal. But to do that, we have to be very, very intentional that we are providing a service that patients are willing to pay out of network benefits for. Patients have to say, I've never experienced anything like what you guys have offered. I never want to experience anything less. I'm willing to stay with you.
Yeah. And to do more dentistry while you have the patient in the chair. So great.
Correct.
Yeah.
Correct. So
good.
Yeah.
Oh my gosh. Well, I can talk to you guys all day. So grateful. Thank you for taking the time out of your incredibly very busy practice to come and talk to us. I know there's this episode will be well listened to, and I'm sure there'll be people taking copious notes. If someone wants to reach out to your practice to pick your brain a little bit more, how can they do that?
Probably info@thrivefamilydental.com.
Okay, great. I'll make sure that link is also in our show notes, or that email is also in our show notes. So thank you again. Thank you both for joining. Thank you, Steve, for joining. This has been Growth in Dentistry, a Dental Intelligence podcast. Thank you to our marketing department as well for their work on this show. I'm Katie Polson. Keep growing.